within the NHS. It's not specific to the NHS. Right. So my first question that I'm going to ask is, what's the first step when you're thinking about doing a business case? You put it in the chat and talk it out. Because this is the bit where most people, a lot of people, fall down on. What's the first step in the production of a business case? An outcome, okay. What you want to change, kind of, yeah. So it is, you have to have a problem. You have to have a problem that you need to solve. Yeah, rationale. What am I trying to achieve? The outcome is actually less important. Well, the specific outcome is less important rather than what the overall outcome. So there can be there's lots of ways of doing it, but the biggest issues I've seen in business cases are those where you are you've got a solution already. Yeah, so you say you want a particular brand of product, or you want a particular pathway, or you want this specific thing. If you go into a business case with that in mind, then it's very hard. Then you're too focused on that particular pathway, and you don't consider all the other options. And so that is the biggest problem that I've seen in business cases, is they want to buy that product or do this particular way of doing things. So your problem needs to be quite broad. So, for example, one thing that we did recently. So at the moment, I'm doing some sustainability work, and one of the options is to put a business case in to do some gas capture. I'm an anaesthetist, so a gas capture device to reduce our to absorb some of the anaesthetic gases that we use. But actually, my overall aim is actually to reduce the environmental impact of our anaesthetic gases. Okay, so that's what my aim is. The gas capture device is just one of the options that we need to consider. Okay, so so you have to have a problem of some sort that you need to solve. Okay, and then that's where you start from. Okay, the second bit is then who are you pitching the business case to? Okay, you need to know who is going to be listening to your business case, or who is going to be deciding on your business case, because that'll give you an idea of the criteria that they are going to impose on you. So and this applies to funding applications and all that kind of stuff as well. Okay, the same principles apply. So when you have a business case, who are you pitching it to? Who's going to be looking at it, and is that the right are they the right people? So over the course of these kind of events, I've spoken to people about pitching business cases, and they've tried to pitch a business case for improving trainees accommodation or training equipment to their so I think the radiologist wanted to improve their trainee reporting room. And doing it within a trust, they weren't really going anywhere. So the suggestion was maybe we should try Health Education England, because they have budgets for trainee welfare and improving trainees. So actually, they were the better option. We did a business case recently in my trust for prehabilitation, so exercise programs before major operations. Now, doing it within my trust, it's very difficult. Even the CCG actually may not be the best people, because the kind of operations that are going to benefit most from prehabilitation are the big, long, complex operations that are funded centrally by the specialised services, by specialised commissioning. So if you pitch the business case to them, NHS England, it was NHS Midlands, the regional team, and we were successful. So it's partly knowing who to pitch the business case to, and you have to have the problem. So they're the kind of two first kind of steps that you need to kind of address. So find out your process, look at your kind of pro formas and forms that you need to fill in. They'll be on the intranet. There'll be a process that you've got to go through, particularly for internal business cases. Okay, and then next we'll come to the kind of the bulk of it. So what needs to be in a business case? What kind of things do you think need to be in a business case? Costings a little bit, yeah. Evidence. Why? Yeah. Risks, KPIs, okay. Case for change. Good. So you need to basically cover all the who, what, where, when, why, how. Okay. So all of that kind of stuff needs to be in the business case. It's got to be a good way of, you need to show that you've thought about all the different aspects of it and put it down in writing. Now the structure, so this is the 5 case structure. Okay. Now it looks quite overwhelming to start with, but we're going to break it down into little bits and go through that in a bit. So these are the key components. I'll come back to it in a second. You have your strategic case, what's called your economic case, your commercial case, your financial case, and your management case. Now, it's clear from this that no one person will be able to write a business case on their own, okay? Because you need help and advice from the people who are experts in their respective fields. So for personnel, you need HR. For procurement, you need a procurement team. You might need your contracts team, depending on what kind of contracts we're talking about. You'll need your finance teams to be involved. You need your management teams to be involved. So you need to have, it's a group effort, okay? And that's important to know, okay? So with all these things, we start on the left-hand side, we start with the strategic case. Now, depending on the type of business case, you may not have to do all of these different bits to greater or lesser degree. It is a staged process. So if you are doing a big business case, you know, a significant amount of money, you break it down to 3 stages. Okay. So you have your strategic outline case, where you establish your case for change and you get an idea of how you want to proceed. And you start doing an appraisal. You decide to do an appraisal of the shortlist. So you do your long listing there. Okay. Then in your outline business cases, where you kind of do your appraisal of the shortlist and you get your preferred option identified. Okay. And then if you need to procure stuff, then you go through procurement. Now, by the time you get to the full business case, that's just before the contracting. Okay, so that's once you've got all your procurement lined up and you've identified which is the best one to do and things like that. So that's kind of it's a done deal, and this is more how everything's been arranged in terms of how you're going to implement it and everything else like that, rather than whether you're going to get your business case through or not. Okay, so you start at the beginning. By the time you get to your outline business case, and if you go to proceed with the procurement process, your business case is going to be funded, and it's just then going through the next stages of management. Okay, and again, to give you an idea of how you might do it, so your strategic outline case is where you do your context and case for change. Something called SWOT analysis. So that's where you identify the strengths, the weaknesses, your opportunities, and the threats. So, you know, of your system, you might have your strengths, you identify your weaknesses, you identify where the opportunities might be, and where your threats are. Okay, and you get a start to get an idea of the ballpark figures that you're talking about, because that gives you an idea of what kind of procurement process you need to go through and who needs to get final approval. Because depending on the organisation you work for, whether a foundation trust or not, and whether and the amount of money involved determines how high up the chain it needs to go. And then when you get to your outline business case, you have you identify your preferred option, and showing value for money just means that you're going to show value for society essentially as well. You need to have quality outcomes. and you get an idea of your procurement and commercial plan, and you get an idea of how you might want to deliver this, whatever outcome you're doing. So by plan for delivery, we mean, are you going to pilot it? Are you going to do a gradual rollout over a period of time, or you can do a big bang rollout? And what is the that's what that means there. And then once you get to the full business case, you determine your contract arrangements, where the money's coming from, who's paying to pay for it, and then you kind of work out your detailed delivery plan, including timings, your risk analysis. So what may go wrong, if there's a hiccup here or there, what your contingency plans, and if things go really wrong and there's a massive delay or it can't go ahead, what's your fallback plan? So these all have to be done in the full business case. And again, depending on what your business case is for, you'll have different aspects of this to greater and lesser degrees. Okay. So for very, very small business cases, there's something called a business justification outline case. It might be called something else in your organizations. It's used for simple low-cost projects where either you already have it in your trust and you're repurposing it for different use, and you don't need to have any formal procurement processes needed. So example of that might be using a medication or something in one side of your trust, and to use it in a different area for a different purpose. It might need to increase the amount you buy in, but you don't actually need to go through a formal procurement process. Okay. So going back to this strategic case, I'm going to go through each, basically the strategic case and economic case mainly, and then we're going to come across some of the issues you might find in the commercial and management cases. So the strategic context means what is the issue? Okay, and it's really important to try and align it to your organization's aims and ambitions. Okay, so you will have a plan. Ours is becoming the best, and you have your trust values and all that kind of stuff, and you need to show how your business case is going to fit in to your ICS or trust values, depending on who's looking at a business case. Okay, and it has to really align with it somehow for it to proceed. Some organizations have a kind of checklist where if it goes against any of the key metrics, key performance indicators, so if it's going to negatively impact or potentially negatively impact your 2-week wait, or if it's going to negatively impact any other kind of key metrics, then it won't be considered. So it's worth just making sure that you can fulfill those kind of, it's not going to negatively impact any key metrics. Okay. So when we talk about the case for change, so you look at, again, your objectives, look at your existing situation. What is it that's the problem? What's your current arrangements? You can use demand and capacity modeling to look at your current demand capacity and what your future demand and capacity will be. So if for example, if your demand has been increasing by 2% every year, you can predict that it's probably going to increase by 2% in the future, and if you haven't, and then you can use that your capacity modeling to try and work out what that implies. You can look at your potential scope. So what that means is how big a plan are you asking for? We can build a whole new hospital if you want to improve services, but that's not always within our remit. What is it? What kind of scope are you considering? Is it just an extra clinic? Is it a whole new service? Is it something else? You have to try and work out what your limits of your scope are, and that kind of comes into the next stage when you do your options appraisals. What are the benefits? You need to have some benefits, obviously, of not just to your organisation, but ideally to the ICS, to your system. And what are the risks? Okay, so what are the risks if you don't have this? If this business case does not go through, what are the potential risks? Okay, how is it going to impact things? And for the case for change, it's really useful to use the kind of model health system. So use lots of information that's already out there. So you're getting it right first time, your various NICE or Royal College guidance and standards. You can use your benchmarking. There's various benchmarking tools, including model health systems, to give you kind of ammunition to try and build a better, stronger case for change. It's important to look at your constraints, and by that it's most commonly it's infrastructure. It's just logistical space. It's normally the biggest constraint. So what's going to limit your scope? Okay, what's going to limit how far you can develop? So a big constraint at the moment is workforce. So we can say that we want, we're going to build a new service and we're going to have 10 extra nurses and this, that, and the other, but if we can't recruit already to our existing, we've already got a massive shortfall of nursing staff, then the likelihood to be able to recruit another 10 may be a constraint, may be a potential issue. In the same way, medical staffing is a big issue at the moment, because the pipeline for getting junior doctors into posts is quite limited. So we can say I want an extra tier of anaesthetic cover to cover my new ITU or my ITU extension, but where are they going to come from? So what's going to limit how big a scope you want? And in the same way, what is this part of a bigger plan? So is this business case? Are there other projects dependent on this business case going through? So, for example, we're in a process at UHL of moving our going through a site reconfiguration, which involves moving or reducing the level of one of our ITU. So rather than being a level 3 ITU, it'll be an HDU area. But we're still going to have medical patients. So we had to put a business case in for the kind of outreach nurses, so whatever you want to call them, but outreach nurses to help support our wards. But if we don't have 24-hour cover of that, that's going to impact our ability to perform the whole site reconfiguration. So what else is dependent on this business case going through? Then again, that adds a stronger case. Right, so probably one of the most important things you can do is come up with your key critical success factors. Now, by that is, what criteria are you going to judge your options against? And it's important to get a broader level of input to when you're determining your kind of success factors, your criteria. Because there's lots of people that are going to be involved potentially, depending on the kind of business case, and so you want to have other people's inputs into the process. Okay, so what are the broad, and you need to rank them to a degree, and so they can be weighted. So when you're looking at a long list, you can score them, and ideally it should be scored independently. And then you look at them as a whole. So once you've got all your options together, you then score them against your success factors or your criteria, and that will help you determine your options. Now, depending on what kind of business case it is, you either have a long list, which then goes down to a short list, but you need at least 4 different options. Okay, realistically, and sometimes it's very hard to think of other options. So, but you must have a do nothing or a minimum viable option, okay, as one of the options. And then the thing to do is think about, okay, what if your preferred option wasn't available? What would be your next best option? Okay, how could you achieve what you want to achieve in another way? And it's just worth just looking at that to come up with your short list. Strictly speaking, there's something called an economic appraisal, but essentially for NHS ones, you just need to show quality. You just need to show an improvement in quality. Okay, and that in turn will show value. But that's an important thing. You need to show from the value equation before, you need to show that how you're going to deliver value by improving quality. Okay, it's less about my finance, it's just more about quality. Okay, so when you come to do your options appraisals, there's lots of different ways of doing it. There's again, you can just use your criteria and weight them and do it that way. Another option is to do it in this way, which is basically using a matrix. And again, you can use this to fill in your options and then build your options up from there. So if we were to use HS2 as a potential way of doing this, okay. So your scope is, so the problem we're going to be facing here is to improve the overcrowded, improve capacity on our rail network. Okay, so that's the underlying problem. We have no residual capacity on our network. So our scope is to connect. Minimum would be maybe to connect London and Birmingham. Our intermediate would be to do London, Birmingham in the northwest, and the maximum would be to do London, Birmingham, northwest, and cover Yorkshire and Humber, maybe even the northeast. Okay, so that gives you a scope. So how much are you going to do? Okay, the service solution is how you're going to do it. So the minimum would be to refurbish existing tracks. Okay, so we can refurbish the existing tracks, increase the capacity by that way, just expand them slightly. Intermediate would be a mixture of refurbishing some bits of the existing track and building some new tracks. Okay, and the maximum will be to build a whole new rail system that connects London, that connects the areas we want to connect. Okay, so the scope and solution can be that they're obviously intrinsically linked, but you deal with them separately. Okay, because and when you rate them, you do them separately. So service delivery is you can do it is who's going to do it. So for this example, it would be a local contractor, a national contractor, or an international contractor. But there are other ways of doing it, you know. Implementation is minimum would be to do it one bit by bit. So you do your first bit, the London to Birmingham, Birmingham to Liverpool, and the final one would be to do staged. The intermediate would be to do do a number of segments at the same time. A maximum would be to do all 3 segments at the same time. So that'd be your implementation. And then funding can be, you know, it can be from internally, from, you know, it can be self-sustaining model. It could be from intermediate, could be from a mixture of private and government funding, and maximum could be from a new tax, passenger services tax that's going to be implemented. So there are different ways of doing it, but you just need to look at it. And then what you do is then you kind of you can highlight the ones in red, which are no-goers. You know, so the minimum option of just doing London to Birmingham is not really a goer. We probably could, if need be, do just London to Liverpool, so that could be yellow as a potential. But our preferred option would be to do London to connect all three sides of the country. So that'll be our green. The service solution, well, maximum is not an option. We can't do all 3 at the same time. We haven't got the capacity to do that. Intermediate, we may be able to do some stuff at the same time. But ideally our preferred is to do the minimum, which is do it stage by stage. And you go through and you kind of work out what's a definite no-goer, what's a potential, and what's your preferred option. And that way you can evaluate it in that particular way of doing things. Okay. As I said, this is suited to certain types of business cases, and a weighted assessment criteria is suited to a different type of other business cases. And you can do it in different ways, and you've got to work out which one's most suited for the kind of process that you're doing. Okay, so we've kind of covered the strategic case and economic case. So any questions on that bit, and I'll move on to the other bits and some of the potential pitfalls, the other bits of the business cases. Nothing else giving me time to drink some coffee. You can shout out, you can
Hi there. I've got a quick question.
Yeah.
Most of the things that we consider business cases for, I'm a sexual health physician in London, are actually fairly small in terms of scope and impact. So it might be, a fairly cheap off the peg IT fix for our appointment booking service. It might be a facilitator to help us marshal our newly diagnosed patients. So there isn't like a big bunch of options and a big bunch of potential outcomes. So obviously this is a very comprehensive side set for probably quite big projects, but in your organization, do you have like a simplified approach for the ones that are much smaller in terms of the scope and the purpose?
You do, and I mean, I said that this is trying to cover all things. The smaller ones, you cover the same kind of things, but you do it to a smaller degree. So you may only have one or two options, but the idea is that you still have to go through what the problem is and what the options you can, your options may be limited, but you have to have shown that you've thought about them, because what happens, all that, and if you need a business case at all is the other thing. If you can fund it internally, you may not need a business case. If you need a business case, it's probably worth showing why you want it in this particular way and why you considered X, Y, and Z. Because that's what ends up happening, is that somebody else who doesn't know your particular situation will come in and go, well, why don't you do this? Why don't you do this? And that just delays things even further, while you then kind of answer that back again.
I think one of the issues in our organisation is the whole process is really opaque, both in terms of what requires a business case and what doesn't, and you get very inconsistent answers. And also, there's no real sense of a good example of what makes a business case fine, what doesn't. They get rejected without feedback, I suspect. So this is actually super interesting and super useful for us, I suspect.
Yeah. So you don't, but you very rarely get feedback on business cases, which is not great. And I'll show you some examples towards the end of things that I've been involved in where, so I don't write business cases as much anymore. I tend to review them for different people within my organisation and around. And it's just looking at the business case, and the other big thing is they're often too jargony. They're often too full of medical terminology, and a lot of people reading the business cases are not medical or clinical. I may not understand the quirks of your particular. So, for example, in ITU, they may not understand all the requirements and the health and the infection control and all that kind of stuff. So you may have to actually spell it out for them why you can't just do this, or you just why you have to have it in a particular way. And that's probably one of the big issues that you find, is that they get rejected because they say, oh, well, they can just do that. But you need to explain why what would seem a stupid idea to us, because we know the details, is not why we haven't considered it, and we have to explain it in more detail. And that's probably another big area where things get dismissed, is because we dismiss potential options because they're clearly, for us, with the knowledge that we have, are no-goers. But to other people who don't know, if you're externally viewing it, why can't that happen? Why can't you do this? Why can't you do it this way? Why isn't it as straightforward as it seems? Does that make sense?
Yeah, that's brilliant. Thank you.
Neil.
Yeah, I probably have the opposite problem to the chap who's just spoken. The problem's too big rather than too small. And I guess most of us here are clinicians, so the bit of the where we get most involved is probably trying to get an outline case or strategic case to get the appropriate people, who would probably be the ICS or the the merged big CCG on the ICS footprint, to actually do the economic, commercial, financial management, and go through the whole thing for us. Because as clinicians, we recognize where there are horrible holes in pathways, and it's persuading them. And very often it's clinicians from more than one organisation. So, for example, I'm a consultant psychiatrist, so old age psychiatrist. So I see a lot of people referred to us for alcohol-related brain damage, which we're not commissioned to do anything about. Yes, if they had alcohol dementia, yeah, we'd be commissioned for that. But the pathway, well, and I would say, and a lot of people would agree with me, that actually we need in our system, our ICS footprint, to actually completely review the alcohol pathway, public health prevention, acute hospital, alcohol-related brain damage, dementia, residential care home, police, homelessness, vagrancy, and there's a lot of partners involved. So even just getting the basic outline strategic case, yes, it'll involve me probably trying to get together with clinicians from our local acute hospital, from social services, from the police, all this, just to get the case forward, which, of course, to me looks like barn door obvious because of savings from reduced A&E and hospital admissions, reduced police, reduced incidence of very disabling illnesses that lead to expensive care costs, But you'd be surprised how difficult it is just to get out, open the door.
I think you're right, but I think it was something of that size. I mean, that would be in the kind of in the business case world would be, so that would be deemed a program. So that whole, because it's so big and so complex, that's a program, which is an umbrella kind of process. And you have some goals for your program, and underneath that you have multiple projects, and you have business cases for these individual projects, and it's how you build it up together. So it's far easier and to kind of put them into more bite-sized projects. And you might, because it's a smaller project, because there's projects, each project smaller, you might be able to get them to do a business case for a particular project rather than trying to do the whole program in one go. So that's what other areas have kind of found, not just in the NHS, but in the public sectors. You start off with a program, and because if you said to me and described what you're hoping to achieve, I would go, oh my God, that's trying to put together an economics, commercial, and financial case for that is a massive undertaking, and I'd be quite daunted by it. But if you kind of broke it down and said, that's our program, this is what we want to achieve, but it's going to make up of multiple little projects, and which are more manageable, and you can assign it to I don't mean to demean anybody, but somebody, you wouldn't need to be the director of finance and needs to get involved with this. It could be one of the one of the kind of business partners who can get involved with this, because it's more focused, and you build it up as a series of projects with the ultimate goal of doing this with this program. That's how I would approach what you're trying to describe.
I can see where you're coming from. It's just that unfortunately I have the scars from seeing the smaller project piecemeal approach leading to a complete non-integrated pathway.
Oh no, but you need that. You need it under. That's what I'm saying. You need to build a program first, but then the business case bits are individual for projects. So you have to have it integrated. Yeah, you're right. You don't want to do it piecemeal in that way, but you build a program, have all your projects lined up all in an integrated manner. But when you deal with the actual business cases, you put them in as separate projects, is what I mean. There is guidance on that one. If you look at the Treasury website, there is guidance for programs and projects and how to put them together, which might help you, because it's all about being integrated. It's not trying to be piecemeal in that way.
Thank you.
Okay. So going back to if any other questions. Neil, is that still?
No, I was just trying to lower my hand.
Okay, no worries. So just a few quotes. I'm not going to go into the commercial processes in too much detail, because they do need specialist input, and some of these things change over the years. But it is important to note that things like procurement, there is a legal framework for procurement. So depending on there's a whole procurement regulations which came into effect in 2015 and incorporating the EU procurement laws, which means that above a certain amount you have to put things out for tender. There are procurement guidelines and specific amounts. I've got them in front of me. So the ones from 2019 are that if you are looking for supplies or services, depending on the impact, anything above like £118,000 needs to go out to contract, and that's what you're contracted for. So no, it doesn't mean that's the individual value of a year's worth. It's if your contracting is likely going to be for 5 years, it's likely that you're talking about £100,000 worth, and so you may need to put it out to tender. So there's a whole process behind it. So it's just worth thinking about getting your procurement teams in early. They have various things like NHS has framework agreements and complex procurement towers and things like that, which may limit what you can procure. And so it is quite a prolonged process and that goes with a whole legal framework behind it. When you're looking at personnel requirements, it's important to recognise that things like when you're looking at staffing, you need to factor in working time equivalents or full-time equivalents. So to staff, and that's based on the fact that anybody on the agenda for change contracts are based on a 37.5-hour working week, and consultants or medical personnel and consultants, if you're looking for extra consultants, that's based on a 42 week year. So if you're looking to staff something for every week, so a clinic every week of the year, then you're looking at 1.2 working full-time equivalents roughly when you're looking at your funding. If you're looking at staffing an extra nurse on a ward for 7 days a week, 24 hours a day, that's potentially close to 3 working time equivalents. But your HR will have the specific details about that. So it's just worth appreciating that your personnel requirements may be an issue. It's also useful to look at when you're looking at your timings of everything, that the recruitment processes can take time. So a new consultant post often needs Royal College approval. So that can take a bit of time, and then you've got to put the job advert out. You've got to get them. You've got to do the interviews, and then you often have to leave. Consultants can take up to 6 months if they're somebody in training. They can interview within the last 6 months of the training, so it can potentially be 9 months to a year before they're in post. So you need to make sure that your funding and timings and your business cases match up to that. It's also useful to kind of be realistic about who you can recruit. It's all very well, again, saying that we're going to have 10 extra nurses. Is that realistic, or do you need to think of other ways of working, using enhanced roles for other allied healthcare professionals, and think about different ways of working, because that's also another way of dealing with workforce issues. And then finally, contract issues. Just be aware that a lot of trusts are involved in have ongoing contracts, which are either managed contracts or contract commitments. And we had an issue where we bought a exercise machine for our cardiopulmonary exercise testing, and that had let's say it was an HP, let's say it was a Dell computer built into it, and we have a managed services contract in our IT department with HP, which meant that the systems didn't talk to each other. and it meant that there was actually 8 weeks where the piece of kit was completely useless because we couldn't, we had to replace the hardware, and then had software issues and all that kind of stuff. So be aware of what existing contract arrangements there are. Also, when you're working out how much things cost, you have to use something called the life cycle cost, or the whole cycle cost. So some companies will give you, particularly when you're procuring equipment, they'll give you stuff. They might give you stuff free, and you have consumables which you pay for. Other places will give you, you have to pay up front, but the consumables will be cheaper than overall. And depending on your usage, or your projected usage, will determine which one will be the most cost effective, or which one will cost the least amount. Because if you are not using it very often, then paying a higher amount for consumables is probably worth getting the free stuff in the first place. If you've got high usage, then it may be that you need to pay up front a bit more and have a lower consumable rate. And you ought to think about how long a contract you're going to think about, you're going to sign up for, and does it include upgrades in between? So if new technology comes in, or they release an upgraded version, are they going to upgrade the system, or are they not? So you have to think about all these things when you're looking at your contract issues. How are you going to pay for this? It's always interesting to look at. There are lots of funding bids out there. There are lots of pockets of money out there. So an example. So we've been thinking about electronic consent for a number of years now to address some of the issues that we had in our consent processes. And we were struggling to fund it. So we thought it was a really good idea, but trying to get funding in while we were trying to do this whole other EPR thing was a bit big of an issue. And then we came across NHS Digital, actually had some funding for electronic consent and electronic pre-assessment. And because we'd already started doing some of the work towards it, we put in, it was relatively short notice, but we put in a bid for it, and we were successful. So now we've got the funding for electronic consent. So we know that we're going to pay for it, and actually that's made life a lot easier. Okay. If you are saying you're going to get savings, you just need to work out over what kind of time period that savings is going to be, and is it realistic savings or not. Management case, as I said, how's it going to be delivered? Big bang, slowly. You have to think about some contingencies. So, for example, what's going to happen in the meantime, or during that time when you're changing the pathway? What's your interim plan? As I said, we recently moved our pediatric cardiac surgery service from one site to another, and during that weekend where we were doing the move, one of Birmingham Children's did our emergency work because we were mid move. So thinking something like that. So what's going to happen? What kind of time frames are you looking at? One of our previous, one of our project management meetings, they didn't allow time for emergency work to be transferred across, and you just got to look at the timings of how that was going to work. And the impact on service delivery. So that's not only in your service, but in the other services that may be affected by you. And that can be a bonus. It can be you can be using it as part of your benefits, but also you've got to think about what's going to happen in that during the build process or the implementation process. So so this is an example of something that I thought was a poor business case graph. So this was something that I came across. I was reviewing a business case, and I don't even know what it means. I don't know what perioperative care impact is. Is that a good thing? Is that a bad thing? Is higher good, lower bad? I don't know. What kind of time scale is that? It doesn't really say. It is a nonsense of a graph. So just be wary of the data you put in, and make sure it's accessible to other people to read who may not know the understanding. I mean, as an anaesthetist, I don't know what that means. I certainly wouldn't know. I wouldn't expect anybody else who's not an anaesthetist to know what that means either. Okay. Again, this is it's a very detailed, but doesn't actually say anything about what it means. There's no context for it. It doesn't really show a before and after. So this just tells you the perioperative pathways. It doesn't tell you is it a good thing? Is it a bad thing? Is this what you wanted to? Is this what you're aiming for, or is this what it is at the moment? This was just stuck into a business case, you know, with no context. And then this is again, this is for one of the consent things. So an opening statement. So this is quite a wordy, waffly thing that doesn't really say a lot. It's quite technical. PAS, EPR, it's not really working. Whereas this incorporates a much bigger, better way of saying something. And as an opening statement, it's probably gives you a greater impact. Right. So it's always useful to present your ideas before you submit the business case. Engage other people, particularly anybody that's involved in the decision process. So if you are if you know somebody who's going to be involved in the process, get them to look at it, get them to address their concerns, incorporate their suggestions, get as many people involved as possible, because if they're part of it, they're less likely to put barriers up. In terms of time, there's I mean, two other things. Is timing is important. So depending on the type of business case and what you're trying to say, end of the financial year, to kind of February time, there may be some underspends in certain pots of money. You know, the NHS is notorious for having budgets and pockets of money for different kind of allocated for different things, ring fence for different things. So it may be that there's an underspend and you can get that money from an underspend. But if it's a big bit of money, or you might need to go in towards a new financial year, or at least ask for the money to start in a new financial year, where there's an increase in funding. Particularly if you asking in the kind of September, October for the next financial year, that's a very good way of doing it, because that can then built into the negotiations for with your commissioners, as if you're a provider organisation. The other thing to do is, if you have a small business case, make it part of a bigger business case. So, you know, if you want to get some equipment and you're building a new thing, it may be that you can get that equipment as part of another business case, a bigger business case. You know, we got a lot of transport ventilators when we built our new A&E. We got a few new anaesthetic machines when we built our new A&E, because we put that business case as part of the bigger business case. So a few £1,000s here and there is when you're is nothing compared with when you're building a £50 million new A&E. So, you know, incorporate it into other things. It's always worth, increasingly now, it's always worth looking at your ICS partners, because if you get them involved, particularly if you want ICS funding, if you have multi-organisations putting forward a business case, it's much more likely to get funded, because it's multi-organisations and it will be deemed to be beneficial to the whole system, rather than a single organisation business case. Okay, so somebody in the previous talks have mentioned that you'll get these slides, but there are these things called the NHS oversight metrics, so which have been published, and then there's the system oversight metrics, which are always useful when you're building your business cases up, to see what metrics are being considered. But Any questions at all on any of that? 10 minutes, hopefully. Questions, yeah. Is that just silence or?
Don't worry, it makes it very clear.
Good. You'll get a copy of these slides with all the references on and everything like that. And the links will be built into that. So. I said business cases are notoriously complex, and as one of the other somebody else mentioned, it can be quite an opaque process. The idea of this is to give you a little broad structure of how to approach it, how to start, and then how to take it forward. I said I'm happy to look at any business cases if you want me to. And give you some kind of external feedback. Just send them to me. I can have a look at them. We're happy to do that. I have done for a few different people over the last couple of years. So yeah. Brilliant. Well, if nobody has yet, I'll put my email address in the chat, but otherwise you can always contact us via the Future Focus Finance address, and they'll forward it on to me as well. Hope you found it useful. And thank you for your time. Enjoy the rest of your afternoon.